Learn from top professors on the road or in your home with Learn 25. Andrew B. Newberg, MD, is the Research Director at the Marcus Institute of Integrative Health at Thomas Jefferson University and Hospital. He received his MD from the University of Pennsylvania. Dr. Newberg's work focuses especially on neurotheology and the mind-body relationship. Listed as one of the 30 most influential neuroscientists alive today by the Online Psychology Degree Guide, Dr. Newberg's work has been featured on television programs such as 2020, Good Morning America, and Nightline, as well as in several major media publications, including Newsweek, Time, and National Geographic.
Topic 1. History of Integrative Medicine. Emphasis on the whole person. For anyone coming to integrative medicine for the first time, the first question always seems to be, what exactly is integrative medicine? Now, in terms of defining integrative medicine, an important concept is that it combines both current medical practices as well as evidence-based approaches to what are sometimes referred to as complementary or alternative medicine approaches. But such terms themselves can be problematic since integrative medicine as a field needs to consider that all medical practice be regarded as being a kind of unified approach to the management and care of patients. So in other words, there really should not be regular medicine and integrative medicine. There's really just medicine, and all medicine should be well studied, evidence-based, and well executed by people who understand how medicine works and how to help take care of patients. And that really is the first pillar of what integrative medicine is all about. It is about combining all of the best elements that are available to us to help take care of patients as effectively as possible. So when we think a bit more about what integrative medicine is, we not only focus on medications and surgical approaches that we have come to understand as part of traditional Western-based medicine, but we start to look at a variety of other factors that are part of a person's overall health and well-being. This can include things like diet and nutrition, incorporating various healthful foods into their diet, thinking about different supplements and nutrients that might be important to keep their body healthy. It might include mind-body practices, and even some ancient approaches such as acupuncture that might be very beneficial in certain circumstances. But ultimately, this also needs to be combined with cutting-edge science so that the overall care of the patient is optimized. And integrative medicine really attempts to incorporate all of these aspects of care and then ultimately to individualize them for any given patient. Now, this latter point about individualizing medical care for people is really the second essential pillar of what integrative medicine is all about. And it's challenging at times because most research, especially when we think about medical research, is based on the randomized, double-blind, placebo-controlled trial. Now, these are wonderful approaches to understanding what works best in medicine, but part of the problem is that it takes a large group of people, some of which get an intervention and some of which don't, and figure out if the intervention actually works. The result is a bit of a cookie-cutter approach because you're looking at doing the same intervention for every person. And it doesn't take into consideration a variety of individual characteristics that any particular patient may have. So, for example, if you're thinking about, let's say, a patient with high blood pressure, perhaps you have a certain algorithm or a certain approach that has been well studied, and you think about, well, I'm going to give this particular medication to my patient with hypertension because that is what has been shown to be effective in scientific studies. But that particular person may not do as well with that particular medication. Perhaps they have other medications that might interact with it. Perhaps they have other medical problems that might interfere with the ability of that particular medication to work as effectively as possible. So integrative medicine asks us to evaluate the entirety of the person, to think about all of their strengths and weaknesses.
Sample complete. Ready to continue?